We have an update. As we speak, the Virgin Islands Police Department has issued a warrant for one suspect on robbery as well as kidnapping. News Channel 8's Wes Small will keep us abreast of these issues and a full story tomorrow. And the controversial dredging at the Lindbergh Bay on St. Thomas is making headlines these days. News Channel 8's Lee Carl has more.
A project that will place dredged spoils from the St. Thomas Harbor into Lindbergh Bay now heads to the Corps of Engineers for review. Despite widespread public outcry, the Senate Committee on Planning and Environmental Protection approved a coastal zone management permit Monday to dredge the St. Thomas Harbor and deposit that material in Lindbergh Bay. West Indian Company VI Port Authority filed the joint CZM permit application on February for the $12 million plan to dredge the harbor and dump 162,000 cubic yards of material into an existing dredge hole at Lindbergh Bay, much to the chagrin of the people that are around Lindbergh Bay. You're watching some footage that was taken in the general area of Lindbergh Bay where the deposit will take place, and the concerns by some of the opponents are that the marine coral and the natural sea life there would be disturbed by the items that would be dropped in. In St. Thomas, Lee Carl for News Channel 8.
Stay with us on News Channel 8. We have more news after the break. The president's approval rating has been dropping lately, and one of the reasons the ratings are falling could be because of broken promises. These promises are about health care. News Channel 8's Wes Small has the story.
Well, recently, Dr. Cora Christian has been on the airwaves, and she hasn't been too happy that you used to have that nice, peaceful, calming, mellow tone about, don't worry, everything will be all right. But she's not exactly happy these days about what we're going to talk about. Doc, the United States, the greatest country in the world, so to speak, I just feel that two things should just come as natural, and that's health and education. For the life of me, I don't understand why health should be a privilege. And this reporter, and I'm sure a lot of you, have not been taking your meds because they're just too expensive. Social Security drops out. You know, I went through all this with you, Doc, when you had the AARP thing and Social Security representatives. Remember when I was trying to find insurance? And I'm not in the boat by myself. There's a lot of people, and you're a doctor. I'm not really happy with the doctors either, because y'all charge a lot of money. Sometimes they don't even want to know what's wrong with you. Are you insured, Mr. Small? And that just kills it right through the bulletproof window. I just walk away. Doc, what's going on, and why are you angry?
Well, you raised two issues, medicines and insurance. Let's do the medicine piece easier.
Okay.
Well, really, they're combined in a way, but the medicine piece, AARP just nationally had an opportunity to close what was called the donut hole for older Americans, where their prescription drugs, they would pay a portion, 75, 25, the federal government paying 25, they paying 75, they paying 25. Then there was a hole where they had to pay the full amount, and then after that it was a 95-5. Well, we just closed that hole. It's now 50-50. The pharmaceutical companies have come forward and said, we'll pay the other 50%. And this has been a national news. Our CEO from AARP.
Y'all worked hard for that.
Worked very hard, and just had the president sign that. So it's clear that prescriptions is a big issue. Now, prescriptions is a subset of general coverage. And one of the reasons I think President Obama was successful was he was very clear in his campaign. Universal. Universal means what? Everyone. Universal coverage at an affordable level and choice in reference to healthcare. That's what he said. So why would we settle as people of the territories in the Commonwealth of Puerto Rico for some graduated addition of dollars for the most vulnerable population, those income levels? Now, let me digress for a minute. I have to say this because people don't know this. I said this to someone today. Do you know how much you have to earn, or how little you have to earn to be eligible to get Medicaid? Now, Medicaid is for those individuals who don't have the income to get health care. You want to take a guess? $5,500 a year.
And you're eligible for?
$5,500 a year. If you were in the United States, it's double, triple that. That's unconscionable. That's not acceptable. So now we have an opportunity. Here's the president saying healthcare for all. He didn't say for some and not for others. He said for all. Why would we, as U.S. Virgin Islands and Puerto Rico and Guam and American Samoa citizens, settle for less? Our representatives need to stand up. I don't care about costs. I understand that cost is an issue, but then President Obama wouldn't have even gotten into this conversation if he was concerned about it, because we have trillions of dollars in deficit. He said healthcare is a right, not a privilege. Let's make sure every American citizen. So why are we settling for that? I want all your viewing audience. Call your congresswoman, call the governor. In fact, I want you, if you have friends and families in other states, tell them to write to their congress people and say, look, the Virgin Islands, Puerto Rico, American Samoa, and Guam cannot be treated differentially in a negative way. We need to get health care for all.
I can hear by your voice. You're trembling. You're upset about this. I heard you, and you said that, but you could come and choose our men and women to go to war.
Exactly. Is there an exemption for our men and women?
We have a very high capita.
We have a very
highest population to go to fight.
I was going to say that this morning on the radio, but I wasn't sure about the percentages. But if it is the highest, but the point is this, Wes, they don't ask us, are you from the American Virgin Islands or are you from Puerto Rico? They sign you up. So I want our people to be able to sign up just like any other American. Yes, I'm upset. And our founder, Percy Andrus, she said, Ethel was her first name, she said, and my middle name is that, so maybe that's why I get the fire. She said, what we do for one, we do for all. For all. That's the motto of AARP. So AARP is there fighting. Well, how do you think I feel? I have this national organization. We have the business people, the business roundtable, one of the most influential, all the chambers of commerce, sitting with AARP and saying we support universal coverage for all, regardless of where the people live. We have SIU, the largest union. We have the providers. I got the American Academy of Family Physicians to sign on and say, lift the cap, eliminate and here we're settling for a graduated because of costs. Unacceptable. But if you don't do something about it, your audience, right? If we as a people don't stand up and say something, that's what will happen. Because our, how should I say, our elected officials, they are hired by, you're the ones who hire them. So they need to do your bidding. But if you're satisfied with it, fine. Nothing will happen. But if you are not satisfied, if you think that every U.S. Virgin Islands resident should get health care, then you need to stand up and say, this is not acceptable.
All right, Doc. Well, there you have it. Either you play ball with the Doc, because she's ticked off, and do the right thing. Contact President Obama. Contact Donna Christensen, your delegate to Congress, and put heat on these people. It's either that, or you'll be doing what I'm getting ready to do.
One other thing. I hate to interrupt you, but I think Donna is really with us on this, because in all of her past discussions, she's always said, let's lift the cap. I don't know what kind of pressure. So, it's not an attack on my friend. I want people to be clear on that.
Sure.
It is about the issue. And I'm hoping that if it is that she has to retreat because of whatever political reasons, we put politics aside, we help her understand she doesn't need to retreat. We're going to be there behind her, lift the cap, eliminate the cap on Medicaid.
All right. It's either that, or Doc, do you have any free samples for high blood pressure? Because that's it.
Or maybe a class action suit, or maybe something really legal that we do eventually. Yeah. I mean, there are things that one can do if you really feel that this is your right.
No, really, you have free samples. All right, with Cora Christian, I'm Wes Small, Dr. Christian, for News Channel 8.